So may I please allow me in the name of the government of Mozambique to say thank you for this opportunity to be here, to make this presentation, sharing the partnership of HSE and the Minister of Health of Mozambique. This is the first time that I'm being in Ireland, and I think I will not forget. First, because it's very cold. Second, because I think today is the election in the United States, so I'm making big topics not forget it. And I heard from Jonas that you won New Zealand in Saturday in rugby, so I have 3 things that I will not forget. So this is the presentation that I'm going to do. This is my summary. I'm coming for a Portuguese country speaking in the north of Mozambique, where we are 25 million inhabitants. Our coastline is around 300 kilometers, and our maternal deaths and neonatal deaths, it's our big issue at the moment. But I can say that we have good results in neonatal deaths because the last census that we made in 2011, we are around 135 deaths. So now we are in 64. So it's a big challenge for us, but we are reducing it to go to the ODS for 3 ODS. The prevalence of HIV is 11.5%, and there are some provinces in my country where we have the prevalence of 25%. The life expectancy is 53. We improved it. In 2011, we were around 46. And the health coverage is around 60%. The infections like malaria and TB are the big issues, the burden of the disease in my country. But now we're facing problems like non-communicable disease like hypertension, diabetes, the strokes, and some tumors are occurring because of the HIV, like Kaposi and cervical cancer in the women. So we have a strategic plan in my country from 2014 to 2019, where in our vision we have to give health facilities for all the population, including the vulnerable population. And the mission is to be the leaders of these health cares. So we have 7 aims, and in the first we have to improve the access, and the second aim we have to improve the quality. And we have to improve, and when we have to develop more partnerships, because we know that together we can go further. Alone it's difficult most times to reach the goals that we have target. Our facility network, we are 41 years old before the independence that we heard, and when in 1975, when the independence occurred in Mozambique, we had around 500 health facilities. During these years, we built more. Now we have 1,537 health facilities. The referral hospitals are in Nampula, in the North Province. We have one here we opened last month in October in Zambezia. We have one central hospital here in Sofala, and another central hospital here for level 4. The other health facilities that I've showed you are referral hospitals, but are district hospitals. In 2009, we started a program of humanization and quality in my country. And these are some of the initiatives that we have started: washing hand initiative, the infection prevention control programs, the model patients in service and the maternities, and the Fogela to improve the quality of the labs. The clinical nurse of the medical and the nurse records is one of the initiatives that we started to improve the quality. And the Manchester on the emergency service, we are doing not the electric conversion, but we're doing the manual version using the colors in the health facilities. And the pharmacy management club. So in 2014, our president came to Ireland, and that year in June we signed the Memorandum of Understanding between the Ireland Embassy and HSE, in Mozambique. On September, a team of Mozambique health minister came to make a visit in Ireland. And then on August, a team of Ireland went to Mozambique, and we started a partnership to improve this quality and safety of patients. And we start by building knowledge. And in August, we did the first workshop, and we did this November the second one. We implement or we design the 17 projects. Not the hospitals choose the very big issues that they have, and develop some projects to improve the quality in the hospitals. So we are sharing knowledge of different health systems, Ireland and Mozambique. We are having coaching conversation. We are training leaders. The teams that are coming from these different hospitals, we have one senior from the director, we have a doctor, we have a nurse. And so we try to build a team which was involving all the stakeholders for quality in the hospital. So to improve the quality with local resources. What we have achieved, I know it's a short time. We have started in August the first workshop. Now we did the second one. But we have ongoing 17 projects, as I say, in 14 hospitals, in 3 departments of the Ministry of Health. In different areas, we try to improve quality in the waiting time and the emergency service, to improve the medical and nursing records, reduce the mortality in the hospital, and to improve the patient healthcare profession good relationships. To improve the medical prescribing. In my country, only the doctors and the technician can prescribe, and improve the referral system. As I've told you in the first slide, we have 11.5 prevalence of the HIV. So the patient with HIV wants to come to a health facility, not to take 2, 4, or 6 hours waiting. He wants to go to health facility, take the medicines, and go home. We're trying to reduce also this time to ensure that the patients are not giving up to take the medicines. We think that the involvement of the high level of the ministry. In this picture, I want to show you the first workshop that we have done with 85 participants from different hospitals. Here, this is our vice ministry. So this engagement of the high level of the ministry is very good, and it makes that the other directors of the hospitals take it with so strong and so dedication. This is the second workshop that we have done. This is the second workshop. And here we made a visit to a TB hospital that we have in Maputo. It's the only one that we have in Mozambique. But in the other province, we have 11 provinces in the country. We adopted some inpatient services to treat these patients. Of course, we have distance. The distance is one of the big issues that we faced on this memo of understanding. So we are communicating about conference calls. Sometimes we have problems with the internet. Sometimes we have problems with the conference calls. But we didn't give up. That's why I'm here. And we keep trying to make this plan go forward. In the future, we'd like to do the twin hospital project. It was developed. It was on the memorandum of understanding and on September, but we didn't make it go because we had some problems with the teams. But now we realize it. We'd like to send this project to the other directorates like finance or the human research, because we believe that quality is something which is transversal that we have to share with the other directorates. We'd like to develop a framework of improving quality for Mozambique, as the same that you have in the quality division, and to keep the coaching conversation. The video conferencing Skype, I think, is the only way to reduce this distance between Ireland and Mozambique. only one swallow doesn't make the summer. Together we can go farther. That's why we are here, and I think this is what we have to do together. And thank you for your attention.